I'm glad to be here. I'm glad to see so many anti-poverty activists. We have still more, many more. I'm going to talk about poverty in the United States and in Canada. It's likely been in the news in the United States. It hasn't been on the front page for decades, till the new census report, which showed that poverty was rising and rising rather rapidly. It had gone from 14% to 16%, and poverty experts like Timothy Sneaky were predicting that it would rise still further in the next couple of years. 44 million people are poor, below the poverty line, which is set very low in the United States. And the numbers of people who live at half the poverty level is, and a lot of people have ended up searching for jobs in the low-wage service sector to replace the wages that they lost in a better job. That's happened. At the same time, however, this happened on a ground of social policies that had already been distorted by decades of rollbacks. And I want to tell you a little bit about the American experience in that regard. The slow, insistent, determined cuts in welfare benefits and the effort to introduce work requirements, that really began right after the increase in welfare had occurred in the late 1960s and early 70s. It was almost as if they were contemporaneous. As soon as poor people asserted themselves and started to get some of what they were entitled to, the efforts to close the faucet, so to speak, began. But then in 1995 is when the legislative battle was most heated, a new law was passed, the Personal Responsibility and Work Opportunity Act. The arguments made for this law, well, actually Bill Clinton made these arguments in his 1992 election campaign. He said, end welfare as we know it. He said, 2 years enough to work. And then he, together with Republicans in the Congress, they were in a way egging each other on. He signed a law which was justified because it would reduce what they call dependency. It's a new kind of disease that biologists are studying. That it would curb the licentious and promiscuous behavior of these women who were on welfare, and it would reduce the horrendous costs of the welfare system, which everybody had these bizarre numbers that they would pull out. One senator asserted that welfare costs $200 billion a year. There's no way you can get to that except in prorating the cost of the defense establishment by population. The policy that was justified with these arguments, here's what was done. First, people could only stay on welfare for a limited amount of time, and there was a lifetime limit as well. Second, getting welfare was conditional on working. That's what we mean by work there. And that's what people mean when they say this is a kind of slavery. You don't get assistance unless you agree to work or go through certain work routines like job search. Third, and this is the most important feature, the welfare program was decentralized to the states, and in many states it was decentralized to the counties, and in the form of a block grant. The block grant was at the same level as earlier welfare costs had been, but now the states had the money, or the counties had the money. And they would get it no matter how many people were on the rolls. So there was built into this legislation a strong incentive to the states to cut welfare, because then the funds were available for other programs. This was also true on the county level. And then what the states and the counties also did was they hired for-profit companies to administer welfare. Same sort of idea. You get paid so much for administering welfare. It's not contingent on how many people are receiving benefits. It just contingent on you running the program. There were no safeguards for these private contractors for how they operated. And in effect, what they did was they cannibalized the program. They ate it. And they, together with the public agencies, they made the process of getting on welfare and staying on welfare into an obstacle course. The result is that where, under the old program called AFDC, 84% of eligible families were getting some assistance. Of eligible families, and remember the eligibility criteria are set very low. And under the new program, 40% are getting some kind of assistance. The resulting human tragedies are not being studied. We have very little data on what's happening to the people who are thrown off the rolls because they violated a rule, for example. And even those who are on the rolls are getting benefits at the level of 30% of the poverty line. Well, I think one of maybe the most telling data about the American experience is that in the first quarter of 2010, welfare caseloads, TANF, fell in 34 states. Now, 2010, bad economic year, right? And instead of welfare rising, which is what should happen when times are hard, the welfare rolls continued to go down. And this, by the way, despite the fact that the President Obama's stimulus bill contained $5 billion to the states if their welfare rolls increased. Isn't that curious? They didn't want them to increase even if they got money for it. Canada is not far behind. Really, it's true that about 15 years ago, everybody was watching Canada. Everybody who was concerned about poverty was watching Canada because of the remarkable resolution that passed the Canadian Parliament to the effect that child poverty would be eliminated in this country by 2000. That was an initiative, I think, that was launched by Ed Broadbent of the NDP. And nothing happened. In all the years since, poverty levels have been stuck at 12% in Canada, and now they're rising, as they are in the United States. I think it's about 15% in Canada. Moreover, the real income of welfare recipients in Canada is also falling. And it has fallen, gotten steadily lower over 20 years. And your unemployment insurance program only reaches about half of the unemployed.